Hi everyone. This is a course project for COE 546 Computer Network Design. Our term project talk about secure Internet of Things for monitoring COVID-19. Under the supervision of Dr. Tariq Sultani. My name is Ashraf Saeed and my colleague is Abdullah Barayan. At the beginning, we will give an introduction about our topic, the objective of this research, also the research methodology, the proposed solutions, the design overview, which we propose, some of the challenges which we faced, finally with conclusion. As we know, Internet of Things has growing in a very rapid manner and produce a huge amount of data, which called for the need for new information technology generation and features. Many devices are connected together due to that to achieve a higher sophisticated tasks. In fact, Internet of Things application is growing every day. It has been used with transportations, healthcare systems, smart environment, also personal applications, and many other applications. Let's move our attention to Internet of Things with the healthcare systems. The Internet of Things technology improve healthcare system by these 2 points, which is the sensor can read vital signs and such as blood pressure, temperatures, and heart rate monitor. Also, according to the above, it is necessary to take the advantages of the benefit that come with the advances in technology such as the Internet of Things. So the objective of use healthcare system in general is to improve the patient safety, support effective and efficient healthcare delivery, also facilitate the access to healthcare services, and finally to simulate and use packet tracer for implementing secure healthcare systems. The objective of COVID-19 systems, Internet of Things systems, is to avoid any contact with COVID-19 patient by make distance between the patient and the other unaffected person. Also to remotely monitor and act to help save lives. Provide fast means for raising and alarm emergency cases. Also to secure communications to avoid any threat. Our objective in this research is to develop secure Internet of Things healthcare system to provide different services such as the first one is diagnosing the COVID-19. Second is to transfer data in secure manner by using RSA encryption algorithm. Also with the warning and altering the doctor and the emergency section whenever there is a person who has COVID-19. Our research methodology, at the beginning, we was planning to design a healthcare system using packet tracer by configuring the clinic side and the cloud itself and the hospital. We were lucky and we have found a similar project that has been done in the previous years, and we have adopted, adjust that project to be used with our purpose. We make data processing for the COVID-19 after we adopted the network itself, which we take from previous year. Also, we have adjusted this network with securing the data during the transfer from the clinic into the hospital itself. So we make an encryption data in the clinic side, also decrypted the data in the hospital side, and vice versa. This is our network topology. This is the clinic side, and this is the healthcare side, and this is in the middle. It is the network. We are like doing clinic in each block in the city. We just make for just one clinic. We can make it very large by considering other clinic in each block on the city. The first point, when the patient enters to the clinic in the block itself, we have one clinic. The social distance between, for example, the person one and person two, it has to be 2 meters in order to avoid infection the other patient, which maybe he has COVID-19 and maybe not. So we have to make 2 meters between each two persons. In order to do that, we have make in the packet tracer, and we will explain it by doing the demo in the packet tracer. For example, this patient, if he try to getting close to the other person, there is an alarm will go on whenever the distance between these two patients it is less than 2 meters. If it is bigger than of 2 meters, this alarm it will stay off. Whenever it become near of less than 2 meters, this alarm will go on. One more thing for the data encryption between the clinic and the hospital, and also from the hospital to the clinic. During the transfer of the data, we have to use an encryption algorithm in order to transfer the data with the ciphertext. The transfer data, it's not plain text, it has to be with ciphertext. As we know, RSA, it's in the sender, we have to come up with two keys. The first one is the public key, and the second one is the private key. In fact, there is a relationship between these two keys. These two keys, it has to be prime numbers, and also there is a mathematical relationship between these two keys. Also in the receiver, the same process will be followed, which is it will generate two keys. One of them is public and one of them is private. So whenever the sender wants to send data to the receiver, it has to encrypt the data using the public key of the receiver. And the only one who can decrypt this encryption message is the receiver, since he is the only one who has the private key in order to decrypt the data which he received. Also, the vice versa, whenever the receiver wants to send the data to the sender, it has to use the public key of the sender, and the only one who can decrypt the data is the sender, since the sender who is the only one who has the private key in order to decrypt the received message. And this is just an example. This is the server pair, this is the public key and this is the private key of the server, and in the client the same. This is the public key and this is the private key of the client. So whenever this one want to send data, which is the server want to send data to the client, it has to use the public key of the client. And this is the plain text. This is the encryption functions that make the plain text converted into ciphertext. Also, whenever this one has received the data, it can use his private key, which is the private of the client, in order to decrypt the ciphertext which he received. From here, my colleague will continue.
So now we will make a demo for diagnosing the COVID-19 pandemic. So firstly, this is the flowchart for handling or for diagnosing the COVID-19. The diagnosing of COVID-19 is done based on the temperature level. So the temperature level is ranging from a normal level to a critical level based on the temperature level degree. So firstly, initially the patient is in a normal level where its temperature is supposed to be 35 centigrade. So the diagnosing will start here, and if the temperature is less or equal to 35 centigrade, so the diagnosing will give a result with no disease. if the temperature level is between 35 and 38 centigrade, so here the diagnosing of the patient will be with a normal fever, and here the healthcare center will send a prescribed dose to the clinic to be given to the patient. We consider the patient with the COVID-19 if his temperature is greater than 38 centigrade. And here also the healthcare center will send the prescribed dose to the clinic, and also the when also this is an emergency case, so the healthcare center will notify the ambulance service or the emergency section to dispatch the ambulance to bring the patient from the specified clinic to the healthcare center for more diagnosing. And in the meantime, also the clinic will be notified that the ambulance is dispatched and it's in its way. So now let's move to the back tracer to do the demo or the for diagnosing COVID-19. So this is our general topology, and this is the clinic, and there are many clinics distributed in the city, and this is the healthcare center for processing the data and providing medical services. So inside the clinic will the diagnosing will be done. So this is a thermometer sensor which will do the diagnosing, and this button is used to emulate the increase in the patient temperature, and this button is used to give the drug to the patient to restore the normal condition, and this button is used to activate the thermometer sensor to do the diagnosing. So now the patient is in the initial state where its temperature is equal to 35 centigrade. So now let's do the diagnosing by using the thermometer sensor. So now the system will do the diagnosing, and it will send the result to the healthcare center for getting the result and process the data. So as you see now, the clinic received the diagnosing from the healthcare center with no COVID-19. So now let's increase the temperature level. So now the temperature level is between 35 and 38. So now let's again do the diagnosing to see the results. So here it's supposed to give a diagnosing with a normal fever and provide the prescribed dose to the patient. So as you see here, the result from the healthcare center is given a fever as a disease, and the dose is 1 drug of Panadol, which is prescribed from the doctor to the patient with a normal fever. So now let's also increase the temperature level to mimic the temperature level of the COVID-19. So now the temperature is above 38 centigrade, which is supposed to be with the COVID-19. So now let's again do the diagnosing. And here also the healthcare center should process the data and give a result with the COVID-19 and give the prescribed dose for the patient. So this is done in the clinic. Now let's move to the healthcare center to see what's happening there. So if you see here, the monitor in the healthcare center giving the last result, which is in the clinic, in clinic 1, which is that the patient has a COVID-19 where his temperature is above 38 centigrade. So the doctor in each scenario will receive an email with the diagnosing and with the prescribed dose that given to the patient. So If we receive the emails, this is in the first case with normal, where there is no COVID or no disease. And the second case with a normal fever, where the temperature is 37 centigrade, and the dose is 1 drug of Panadol. In the last scenario that we have explained, the patient has COVID-19 where his temperature is above 38 centigrade, and the dose is 1 drug of hydroxychloroquine, which is a drug that showed a potential for handling COVID-19. So also in the emergency case, the emergency section, if there is any case with COVID-19, should receive an email. It should receive an email with the emergency case to dispatch the ambulance to take the patient from the specified clinic to the healthcare center for more processing. So here we have mimicked the third scenario to give a COVID-19 where the temperature is above 39, which is in clinic 1. So here the emergency section will dispatch an ambulance to bring the patient from clinic 1 to the healthcare center. So if you go back here, so always in the emergency section, there always the clinic will receive a notification that the emergency ambulance is coming if there is any emergency case.
Okay. Now let's move to the encryption and decryption itself. For instance, this is the programming side which we did. Whenever we send the data, as we talked earlier, we have to send it using what? This is just to your informations. Instead of sending the data with a clear plain text, which is here, this is just the plain text, we remove this and we use the encryption algorithm, encryption functions, which is related to the RSA, which is our encryption algorithm, in order to decrypt the data. As we said earlier, since we are sending the data to the server, which is our, we will encrypt the data using what? The public key of the server. And this is the data which we send from the clinic to the healthcare system. So let's come back to, this is the healthcare center. And whenever we received the data, we also have to make what? Decryption. And here is the decryptions which we did in order to converted the ciphertext into what? Into the plain text. Here we will decrypt the data using what? Using the private key, which is the server pair 1, which in our case, the server pair 1, it is the private key of the server in order to decrypt the ciphertext which we received, which was the data. And what else? Now let's move to the simulation of the 2 meters of between two patients. In this packet tracer, we have simulated the entering, for example, this is the previous one who was already in the clinic, and this is a new one. He is coming to the clinic. This incoming patient has to keep a distance between him and the second one. It has to be 2 meters. Whenever he is going to getting close to this person and the distance become less than 2 meters, this alarm will go on. Let's make a demo about that. This person is getting close. Since this distance is less than 2 meters, this alarm is go into on. like he's telling this person, you have to keep a distance. Let's getting back, so the alarm will go off. And that's all. Thank you for listening. This is our term project in computer network design.
Thank you.
Thank you. Okay.